Hi, it's Gavin Routledge here from ActiveX Backs, and today's topic is how to sleep with back pain. Particularly lower back pain and sciatica is our specialism. So that's the focus today, how to sleep. So before the end of this video, you should have quite a few useful top tips on how to sleep with lower back pain and sciatica. But firstly, why is it worse at night? There are a number of reasons. You may have seen some of my videos on what causes lower back pain, but one of the most important things is when you stay still, as most of us do in bed, inflammation builds up. So movement washes the inflammation away, so you feel better, but when you stay still for a prolonged period of time, inflammation builds up and it aches more. Other possible contributing factors are that if you have a disc problem, the disc absorbs fluid overnight, and so often the pain gets worse the longer you stay still, including the sciatic pain, which is one of the reasons it's worse first thing in the morning. Other thing is, depending on the position that you're lying in, so some positions load the tissue that's causing you pain, whether that be disc, ligament or muscle or tendon or any of those tissues. So if you're lying in a position that puts undue strain on that tissue, it may very well feel worse. So those are the most obvious reasons for the pain being worse at night. Another one is, perhaps less obvious, is that there are no other distractions at night. So it's dark, there's no sound, there's nothing for you to think about. So any pain that you're in is often magnified at night. So before I come to the top tips, I'm just going to say this is an advert, so I put out lots of free content to help you, but also in the hope, full disclosure, that you'll come and see us either online via Skype, where we have consultations, or in person in the clinic near the Haymarket in Edinburgh. So moving on to those, what should I do about it? Top tips for how to get comfortable in bed. So the first thing is, before you even get into bed, make sure that you have a decent mattress. Now, I have blogs and etc. on how to choose a good mattress at www.active-x.co.uk. So check out the blog on mattresses, just search mattress. So make sure you have a good mattress, a good bed. And by the way, it's not as simple as the harder the better, but more on that in another video and on the website. So make sure you have a good bed. Before you get into bed, it may be helpful just to do a few little exercises, just to get some movement through your back and kind of loosen things off before you try and get comfortable. Then we have lying down in bed. Now the act of getting into bed is often difficult for some people. So before you go from a sitting to a lying position, just sort of lightly brace your abdominal muscles. So tighten them up and hold them firm as you lie down into whichever position you'd like to. And in terms of which position works best, it's horses for courses. Go with whichever position is least uncomfortable. It could be on your back, it could be on your side. For some people, although I'm not a huge advocate of it, lying on your front may be the most comfortable position, particularly with some cases of sciatica. But ultimately, let pain decide which position you lie in. Now, use pillows. So use pillows to support if you're lying on your side, perhaps a pillow between your knees if you're lying on your back, maybe a pillow under your knees. If you're lying on your tummy, maybe a pillow under your tummy. Just support yourself in a position that gives you more comfort. If you're lying on your side, often lying with both knees tucked up is the best, but if you have sciatic pain, sometimes lying with the bottom knee tucked up and the other leg straight down, the one with the sciatic pain in it. That opens up the side that the nerve is on and helps to relieve some pressure on it. It may work for you, it may not, but try different positions. Accept that any position you stay in for long will become sore eventually for the reasons mentioned before. So it isn't a case of once you find a comfortable position, just stay in it. When you're turning over, do the abdominal bracing thing, so lightly brace your abdominal muscles before you turn, keep them tight as you turn and relax when you get there. Other things you can do, take pain relieving medication before you go to bed. Now, I'm not a huge fan of using pain relief, but if pain is preventing you from sleeping well, there is certainly an argument for using pain relief. Now that could be anti-inflammatories, could be painkillers, but go with your doctor's advice on that one. Paracetamol kicks in about 20 minutes after you take it, so it can be quite fast acting, and therefore for that reason alone it might be the analgesic of choice. There are lots of other tips on the blog. I have a blog specifically on this topic. I can't remember them off the top of my head, and I'm shooting this video in between patients as it is. So apologies for not including everything in here, but I hope you've got something useful from that at least. But there are at least 6 or 7 other tips on the blog post related to how to get comfortable with lower back pain. So thanks for listening. I hope that's been a great help, and look forward to seeing you again soon. Thank you.